Hello, welcome back to my channel. In today's video, we are doing a follow-up to yesterday's video, which was my IVF egg retrieval vlog. Today, we're going to be answering some questions related to IVF and kind of our experience with it. Also going to hopefully do a little bit of education here because I was realizing as I was filming that vlog that I left out explanation for some of the stuff that was happening. I know that y'all are going to inevitably have questions, so I thought I would preemptively ask, do y'all have any IVF related questions on Instagram? Y'all had a ton. So I tried to organize these as best as I can to answer them. Hopefully at the end of this, you'll know and understand like what IVF is or the egg retrieval process and also just like our personal experience with it. And I have Hayden here because he's going to provide the male perspective, even though he's not the one that like...
Yeah, for the like probably 3 questions that there are aimed at me.
No, I think you'll have some input for more than that, but we'll see. The first question we're going to answer, and we'll keep this one, I'll keep it as brief as I can. I wrote a lot of notes for this one. What is IVF? I think that is a question that I get often, and or like what the steps of the process involve. So IVF stands for in vitro fertilization. It's basically the process of taking an egg and a sperm, putting them together in a petri dish, and hopefully making an embryo that will turn into a human child. It is a lot more complicated than that, obviously. There's like multiple steps involved, but it can be broken down, I would say, into 2 major steps, which is the egg retrieval process and the embryo transfer process. In a given month, each woman has a bunch of different follicles competing to release an egg, and whichever follicle is the most mature is the one that releases an egg. So in any given month, most women release just 1 egg. And I'm sorry if I'm using gendered language here. Obviously, there are people who ovulate that are not women. But in an IVF cycle, you want to retrieve as many eggs as possible, and so you are put on a course of stimulation medication, which makes all of your follicles grow at once and mature together. And in some IVF protocols, you're also given a medicine that prevents you from ovulating prematurely. At the end of the stimulation process, which is usually between 8 and 14 days, you are given a drug that then makes you ovulate within a 36-hour time period. At the end of that 36 hours is when the actual retrieval takes place with an ultrasound guided needle through the vagina. The eggs are aspirated from the follicles, and at the end,
That means sucked out like
a vacuum. You're put under anesthesia typically for this process. You are left with a certain amount of eggs, which are then fertilized and hopefully will turn into embryos over a 5 to 7 day period. If this sounds complicated, it's because it is. Also, during that stimulation round, I should say, like during the stimulation period that is again between 8 to 14 days, you go in for blood draws to check your estrogen levels and also to check your follicle development. And the follicle development checks are with a vaginal ultrasound to see how each of your follicles is growing. Hopefully they're growing at similar rates so that you have a ton of mature eggs whenever there is a retrieval. And not all of the eggs are mature. Not everyone has a large volume of eggs. It just really depends on your particular statistics. So that is kind of the egg retrieval process in a nutshell. Just kind of like rattled off a bunch of facts. The second part is the embryo transfer, which we have not personally been through yet. We don't know all of the details involved, but it involves basically putting an embryo back in you so that hopefully you can sustain a pregnancy. First question for us is, why did y'all decide to do IVF, and how long were you trying before you decided to do it?
We tried for, I think, a little over a year, and I say tried.
Yeah, I think try is sort of a generalization, and I think it's interesting to consider what try means to you. For us, we tracked ovulation or at least I tracked ovulation for 3 to 4 months to make sure I was ovulating. I was having like long and irregular cycles after coming off of hormonal birth control, which is like a whole nother story. You can listen to more of that in some of my weekly vlogs, but I knew I was ovulating, and within, I would say, 4 to 5 months, I kind of knew something was up, but I personally wasn't really ready to take the next steps of like getting tested and all of those things. So I think we just kind of carried on for a little over a year.
And also we were at a point in our lives where we weren't really sure what the next year or so of our lives were necessarily going to look like. And so we weren't 100%. We're definitely trying to have a baby or get pregnant, but if it happens, that's also fine. Like it would be fine. It would be great.
Started to figure out like what our life was going to look like over the next couple of years, and that we were going to be staying here rather than moving into a different city, which is important and something to consider. We decided that we would start to get tested. I do think it's important to note too that we had some like context for maybe what was going on. Hayden had childhood cancer when he was about 10 months old, underwent a leukemia chemotherapy protocol that had never been tested before on other people. We kind of had an inkling that that could be a problem.
I didn't think like, oh, there were problems, because in all other aspects of my life, I haven't developed any lasting issues.
Than else,
So I knew that it was a possibility, but I wasn't like, oh, something's definitely wrong with me. It's also easier for me to get tested tested than it is for a woman to get tested. We thought might as well just start with me. And if they said that I was fully okay, then she would get tested afterwards.
Yeah, it's less invasive, and I always recommend if you are in sort of like a het sort of situation, get the man tested first. It's much easier, less invasive.
It's also probably less expensive too.
Yeah, and I think maybe we had different perspectives, but I think for me, again, after trying for 4 to 5 months, red flags were going off, and I was thinking it probably is a sperm quality issue. And I think honestly that was like part of what helped me cope with it quicker, I guess. Like, I kind of knew before we even got tested.
What I was trying to say is that it's not like this is something that I had been expecting to happen for years prior to this. You know what I'm saying? Yeah. I never thought that there was any lasting effects from my chemotherapy treatment is what I was trying to say by like, I didn't expect for it to be.
Maybe just because of intuition or like my negative thinking. I feel like I've just always had this thought in the back of my head that we would have to pursue fertility treatment. I just watched a ton of videos online in years previous because I have always been interested in carrying a child. Well, maybe not always interested, but I've always been interested in pregnancy. I have seen infertility videos and I was like, I wonder if I'll have to do that. It has crossed our mind over the past 13 years we've been together that there could be an issue. Not that there definitely was, but we had thought about it like once or twice before. So how did we decide to actually go through with IVF though? That was definitely a conversation that we had to have. And it's interesting, I think, from like my perspective, our fertility, I should say, and like our testing, the results were that Haden has male factor infertility and that I have PCOS. My PCOS is fairly mild and I am ovulatory. So we believe that I probably could get pregnant spontaneously, but we're not entirely sure. So it's primarily male factor.
I have like a really, really low count in comparison to most people. And so that also precluded us from being able to do IUI.
Yeah, other like forms of fertility treatment. And we definitely had conversations. We have talked openly about adoption in the past. We have learned more about adoption, I think, as the years have gone on, which has made us more hesitant to kind of go that route because there's a lot of trauma involved and that's a whole nother thing. We'll answer that question later. But for me, I think I'd always told myself, even though I like kind of had this inkling that we would have to do something like this, I always told myself, I don't want to do IVF. Like, I'm scared of medication. I'm scared of medical procedures. I've never had surgery before. I've never been under anesthesia. I was really scared of going that route. But I think what I realized as I get older is that like things just happen and you just get to decide how you're going to respond to them in the moment. Like you can say all you want, oh, I'll never do this or I'll never do that. But until you get there, it's hard to say. And for me, it was like, if Haden's male factor is like the only thing that's keeping us from having a child and we can, you know, still have a kid, why wouldn't I give that a try, at least one try? And I did set boundaries for myself too. I will say that I think is something that's important, but I definitely said to myself, I think I only want to do one round of egg retrieval. Well, I mean, obviously we'll get to that when we do, but I was like, I think I just want to do one round and I think that will be my boundary.
And if like that doesn't work out, then
we'll
we need
pursue
to pursue
else.
other,
Yeah, that's kind of how we decided on it. And we have had long discussions. I mean, there's like, we can't go into all of the details on like how we decided to do that, but yeah, we just decided we would give it a try. The next question is, what are the odds of success on the first try? So this is an interesting question because it's really dependent on your statistics. And there's a really cool calculator online that's provided by SART, which is something about assisted reproductive technology, maybe like an institute. They collect data on people who have been through these treatments and their particular fertility issues and kind of spit out numbers and statistics based on that. So for our factors, PCOS, my age, my AMH level, and Haden's fertility, the way that they spit out the numbers is on one egg retrieval with all of your potential embryo transfers from that particular egg retrieval, our likelihood of success for first round egg retrieval is 71%. And that goes up with the second retrieval, which I think is more like 85%.
And what exactly does that mean? Because I didn't know about this like calculator or statistic. What does that mean, like probability of success on first time egg retrieval?
Believe it is live births is the statistic. Okay. I could be wrong, but I'm pretty sure that it is. Regardless, you can check out the calculator online yourself. I think that gave me a lot of comfort going into the process, knowing that it would likely be successful. Obviously, there's no accounting for biology and what your body decides to do. That's a huge factor here. Yeah. But for us, the statistics were kind of on our side. And anecdotally, I had heard that people that had PCOS with male factor tend to have fairly good results. So I felt confident going into it. But I did obviously go in hesitant. I wasn't like, oh, it's going to be a success. I just, you know. Next question is, do you have to have surgery again or was it a one-time thing? I think this person is referring to the egg retrieval process. It, again, is so dependent on your particular circumstances. Some people have diminished ovarian reserve, which means that you have a lower than average number of eggs for your age. And that is going to really impact how many retrievals you have. Some people are only able to get 1, 2, 3, 4 eggs in a retrieval. I will say I was very, very fortunate to have retrieved 29 eggs, 28 of which were mature. So I don't personally believe that I will have to undergo another egg retrieval. We got 13 embryos out of that are being genetically tested as we speak. We don't expect all 13 to
make it through
to be genetically normal, but it is very likely, given those statistics, that we will probably have at least a few to transfer. And again, with their statistics, it's likely that things will be successful. I don't like to treat it as if it's a foregone conclusion, but hopeful, and I try to remain positive, especially that we've had good luck so far. But yeah, I don't think I will have to do a surgery again. And if I do, if we have a ton of failed transfers, we'll have that conversation once we get there. But right now we're hopeful that that will be our only egg retrieval. The next question is a question that I think kind of goes hand in hand with that. Has IVF changed what you were hoping for with your family, number of children, age gaps, etc.?
Sure, it has a little bit, because I think that regardless of whatever your ideas of what you want, I think that that always changes a little bit when someone puts boundaries on it, you know? For me specifically, I don't think it changed it that much though, because I didn't necessarily want like a ton of children anyways. If anything, I think that it just kind of naturally limits a little bit how many kids that you either can or would want to have. It makes you think about it a little bit more, I would say.
I think for me, it's like a yes and situation. So yes, it did kind of make me consider things more. I think to me, it really made me more realistic about who I am as a person. I think this whole process it's taught me a lot about who I am. And I've always had this vision of like being a stay-at-home mom and having like 4 to 5 children like running around and, you know, just like making that my life. And I think if I'm really realistic with myself, I like to work. I love working on my channel. I love being creatively fulfilled. And I don't know that I'd be able to do that with that many children. And in speaking with people who have a lot of children, just kind of their opinions on it, I think honestly, like I would be happy with 1 child. I mean, we'll see. We'll really see. We really don't know for sure. I think you don't know, even when you don't have to face these sorts of odds, you still have to think after you have your first kid, like,
I was going to say, you really don't know until you have a child, right? Like you can have some kind of ideas, but at the end of the day, they're kind of just ideas.
I will say though, yes, it does technically
change things a bit.
Yeah, I mean, if you are someone with diminished ovarian reserve, you only get 1 embryo from a particular cycle and you want to increase your odds. They say that if you have 3 embryos that are genetically normal, that it is likely you'll have a live birth from that. So if you want to increase your odds, it would make sense to do multiple rounds. So you do have to kind of consider that, I think, when you're going into this. But I personally was just very happy with the idea of having 1 child. Yeah, I really came to terms with that. We'll see down the road. Who knows? We don't know how many genetically normal embryos we have.
Going through this process, I think kind of makes you appreciate even just being able to have 1 child.
This is a related question. Has the number of embryos influenced how many kids you want? So now that we know how many we have, has that influenced you at all?
No. So it hasn't influenced me at all. A lot of the process of IVF, I have left decisions up to Chandler, because at the end of the day, it is not my body. I don't have to go through the pregnancy. I don't have to do all of the other stuff associated with trying to get pregnant. And so let's say even if I really wanted to have like 4 kids, I'm not the kind of person, like there's no way that I would ask that of you. And I think that that would be the case for me even if we didn't have to go through IVF and it was just natural pregnancy, even just pregnancy in and of itself. I don't have to carry a baby for 9 months. I will never ask you to do that. It's a decision for us both to make, but I think that for me, it's like a you first decision, and then I can either agree or disagree.
We just happen to have very similar opinions on things. We're in constant communication. It's not like I've really surprised you, I think. I'll answer it from my perspective. I think it does. Obviously, it's very dependent on how many are genetically normal, but we got many more embryos from Haden than we expected. If I'm able to have more than 1 child and I want to, that's awesome. And I think it's opened my mind a little bit more to having more than 1 kid, but we shall see. Let's move on to the next question because that one took a while. Since IVF allows for you to choose singleton or twin pregnancies, do you have a preference? So this is one of the biggest misconceptions with IVF that I see often. I think people lump all of assisted reproductive technology into one bucket and don't seem to understand that it is multiple different things. There's IVF, which is what we did. There's IUI, and then there's also timed intercourse. Now IUI, and I think timed intercourse that is like medicated to help you ovulate, I believe those ones have higher rates of multiples simply because you're taking drugs to essentially make you more fertile. With IVF, you get to decide how many embryos go inside you, but it is highly recommended for people under the age of 35 to only transfer 1 embryo if they want to have a successful live birth. I don't think a lot of people understand that multiples are inherently high risk pregnancies. I don't know all of the statistics and all of the things that kind of go into that, but I had no interest in having a potentially risky pregnancy. That is not to shame anyone who has done that, who's transferred multiple. Everybody's situation is so totally different. It's up to you and your doctor. I think that's a huge misconception. I got that question so many times and I get it, but no, that is just not the case. And it's becoming much less common practice, even with people over the age of 35. The recommendations from the American Reproductive Association, I don't know what the acronym is, they have some very like, please don't do this sort of vibes. And I'm like, yeah, I'm gonna listen to science and what my doctor says. How soon after retrieval can you transfer an embryo? So this is going to vary person to person. There are 2 different kinds of embryo transfers. There are fresh and frozen transfers. Fresh transfers happen typically 5 to 7 days after the egg retrieval process. After the embryos are nice and like developed, cooked, whatever, they put them back.
Cooked?
They put the embryo inside of whoever's going to carry the embryo. Those are becoming much less common because they tend to be less successful because of your high estrogen levels. Typically after an egg retrieval, you're pumping yourself full of like follicle stimulating hormones, so it makes sense that it would potentially be less successful. And then there's frozen transfers, which typically take a little bit longer. These are often done too because people choose to genetically test their embryos, which takes a little bit of time. So your embryos are just frozen and waiting for you whenever you're ready. The embryo transfer process looks super different depending on just your drug protocol, but I would say a very typical one would be birth control pills for, let's say, 2 to 3 weeks, just kind of like hold your cycle until your clinic's ready to go. Then you do, I think, 2 weeks of estrogen support, so either patches, pills, or injections, and then you get like kind of a lining check to make sure that your uterine lining is looking good and ready for a embryo. And then 5 days before the transfer, you start taking progesterone and oil shots in your hiney, and then you get the embryo transfer. It really depends, like how long are you on birth control for? If you're on birth control, how long is it going to take for your lining to develop? It really just depends. I would say earliest probably a month after your egg retrieval, and it's just nice to give your body time to heal anyway, because you're really bloated after that happens. So about a month, I would say. And then someone asked, how long does it take to heal from an egg retrieval? This is something that so widely varies, and I want to emphasize that because on Reddit I saw so many different accounts of kind of what can happen. There is a syndrome called OHSS, which is ovarian hyperstimulation syndrome, that can occur afterwards, where your follicles fill up with fluid more than is normal and you just feel like crap for a little while. It can lead to breathing difficulties and in rare cases death, which is, you know, scary of course. I will say for me, it took me about 3 days to feel like myself again. I would say it takes until your next period to feel kind of like 100% normal, but within 3 days I was able to walk around normally and I felt much better. I was really lucky in that I had just a super easy recovery. I did not have OHSS, which is something that is more common in people who have higher ovarian reserves and have more follicles. I think because of the particular ovulatory trigger that I took, I did not have that problem. So it just really depends on you. Next question is, how long does it take from start to finish, assuming the embryo transfer works? That's a great question. I would say if you're doing it as quickly as possible, maybe about 2 months, but I think that it always takes longer than you think it's going to take. Your body is going to do weird things that you can't control for, and I think that going in with little to no expectation is really smart.
And also that 2 months is assuming that you've already done your testing, done your consultations, you know exactly what's going down, and you're kind of constantly communicating with your clinic and doctors to figure out what the next step is. We have this all planned out and we're just going to go through the steps as quickly as possible. 2 months, but obviously a lot longer than that.
A lot longer than that, yeah. The next question is, what kind of injections are you given and what meds were you on specifically? So everybody's drug protocol looks different. There, I think, are 2 different protocols that are most common. There's the antagonist protocol and there's the long protocol. I was on the antagonist protocol, which is kind of, I think, the drug regimen they give to the most amount of people just because it's easy. So you are given 2 different drugs, or sometimes 1, just kind of depending, to stimulate your follicle growth. I was on Menopur and Gonal F. There are different names for those. I cannot remember the other names for them, but those are ones that you do inject subcutaneously, which means into your fat rather than your muscle. Really short needles, not super painful. And then the antagonist comes in depending on how large your follicles are getting. It's the drug that you take to prevent ovulation. So it kind of like is the antagonist. And I took Cetrotide. I think I started taking Cetrotide on the morning of day 4. I was a very good responder to the medication. I did stimulation medications for 9 days. I took the trigger on day 10 and had my retrieval on day 12. So I had a shorter length of time. But I would say the antagonist protocol typically takes between 8 to 14 days. And some of the other protocols can take longer. I was surprised at my response, but also not. Like, I knew I would respond well, but those were the injections that I was giving myself. So I took my Gonal F and my Menopur at night, and I took my Cetrotide in the morning. Your doctor will kind of let you know what you need to do. The dosages I was on, for half of the cycle, I was on 150 IUs of Gonal, 75 IUs of Menopur, and then like Cetrotide is just 1 dose. And then kind of midway through, they switched me to 75 of Gonal F and staying on 75 of Menopur. Those are incredibly low doses, but again, because of my age and my fertility statistics, that was what I needed. And I was really happy with how I stimulated, and my doctor was too. Was it physically painful is the next question? No, not necessarily. Here's the thing. I hate needles. I am a baby when it comes to needles. I don't want a shot. I don't want to get my blood drawn. But these were some of the least painful things I've ever done, I would say. Near the end of the stimulation, as your follicles start to grow, you start to feel more bloated and you can feel your ovaries moving around inside of you. Your skin gets a little taut and it's harder to puncture the skin. So that was a little painful, like the last day or 2. But leading up to that, I was surprised at how little it hurt. The Menopur did burn a little bit upon injection, but it was over so quickly, it really wasn't a major deal to me. And I would say after the first 2 to 3 days, I was very experienced giving myself injections, and it wasn't a big deal. How did you cope with injections, blood draws, etc. when you hate it? I think for me, the biggest thing that I did was I was given access to a portal or whatever called Freedom Teach. It teaches you how to inject all of these medications. I watched those videos religiously before I even was shipped the medication. I'd also watched a ton of videos on other people and their experiences and their pro tips. I was on Reddit a ton, and I think that sort of desensitized me to the idea of it, to where when I got the medication in front of me, I was like, I know exactly what I have to do. I can do this. I feel confident. And yeah, the first time's a little scary. And there were a couple of times, I'm sure you saw in the vlog if you watched it, that I kind of like psyched myself out the first day, but I got through it. The injections were okay. The blood draws, how did I get through that? I just tried to not think about it, frankly. Those sucked and are by far, in my opinion, the worst part of the process. Everybody's gonna be different. I have really sensitive inner arms, just generally speaking. I bruise really easily, so I got bruised very quickly because you're alternating arms, you're getting blood draws every 2 days for that period. It's not a fun time. This is something that I think I would mention too. We wake up at 8 a.m. every day. We work from home. We roll out of bed to work. I was having to wake up at 6:45 to inject myself with my Cetrotide and then immediately leave to go get my blood drawn before 8:30, so it could be a stat call, which means that the information would be at my doctor's, by 2 or something like that. And that made me feel like shit, I won't lie.
Yeah.
It messes up your digestion, which is not something you want to happen when you were going through IVF injections. So that actually was, I think, more physically painful than anything, was like getting up early and going to get your blood drawn. And I know we probably sound like babies because like most people wake up before 8, but just being thrown off of your routine, it's just not fun, especially when it's for not fun things.
And I know this might sound weird, but the fact that it was only every other morning that we actually had to go get the blood drawn meant that every other day you would get back in bed, go to sleep. So it meant that every day your schedule was a little bit different. So
yeah, it was not great.
Yeah.
I will say everybody's experience mentally is going to be so different. For me, strangely, I did not think of like, oh, there's a baby at the end of this. You're doing this for your future child. I know a lot of people probably get through it that way. I didn't think about that. I literally just thought of, what am I having to do in the next hour? Like, what is the next thing that I have to do? I tried not to think for long periods of time, easier said than done, obviously, about like, oh my God, it's noon and I have to inject myself at 6. I just didn't think about that. I just kept going in my life. At least I tried to. Next question. Did you have to inject yourself? No, this is definitely something that's up to your discretion. You can have your partner do it. You can have a friend do it. I did not want someone else to inject me, and I'm not looking forward to the second part of this process where he will likely have to inject me because it's just in an awkward location. I wanted to do it myself. I like to be in control of my own pain, and I 100% stand by that decision. I'm so glad that I did it myself. And it also makes you feel really strong and in touch with your body almost in the process that you're going through. I know that some people like having their partner involved, and that makes them feel like, oh, we're doing this together. And Haden was there for some of the injections, which helped. And he helped me clean up afterwards, but I wanted to do it myself.
I had a tough time because I know that me being around kind of stressed her out a little bit, but at least for the first couple of times.
We didn't know if I was going to pass out.
Exactly. So I wanted to be around because I didn't want to be off in another room and not hear her fall and hit her head on the counter or something.
Are you keeping a tally of doctor's visits and needles? So I put this question here because I think it kind of piggybacks off the last one. I didn't do that.
Do people do that?
Some people do that. And I know some people keep all of their syringes and needles and like to kind of make a little set around their child and take pictures with like them. Like, we prayed for you.
Oh, yeah. I mean, I kind of get it, but also that's kind of scary.
I don't know. This process has been so interesting emotionally. Like, it's much different than I expected. It's not that I don't think about children. I think once we got to the actual embryo creation stage is when I was thinking of kids. But before that, I just wasn't thinking about that. So for me, no, I'm not taking a tally of doctor's visits and needles, and absolutely no judgment. I want to put this out there. No judgment. I just don't feel like I need to show my kid, oh, you were so wished for, so prayed for. I'm hoping that in my actions as a parent, they'll see that, and then I won't have to prove to them like, oh, 15 needles and 18 doctor's visits to get you here. To me, that feels vindictive, and I know that is not the intention for people, and people are well-meaning, but that's just how I conceptualize that, and so no, that's just like not at all how I think about things. So yeah, no, I did not keep a tally, and I will not be keeping a tally. So at the end of all of this, I think I've mentioned we have 13 embryos. Someone says, when you say you have 13 embryos, where are they?
Funny you ask. They're right here.
That's a great question. The embryos are frozen. They can be thawed at any time. I think actually I was reading recently that the oldest frozen embryo has been transferred or whatever. Like, I think it's like a 30-year-old embryo. They are at our embryology lab, and they're frozen and ready for us whenever the genetic testing comes back.
I wonder how long it takes to thaw them.
I don't know, and I don't want to think about it.
Like, it's not like chicken, like you have to thaw it overnight.
How much does IVF cost, and did your insurance cover any of it? I hate saying this for every question, but it's so dependent on your clinic, your state, your country, and also your insurance. So most insurance plans do not cover fertility or infertility at all.
It's like kind of considered elective.
Yeah, it's considered an elective thing, and that has incensed me at times. I will say we were lucky enough to have very good fertility coverage through my employer. So we had the vast majority of things covered, but I will say IVF really depends. I would say the ballpark I typically see see thrown out is $10,000 to $30,000. I think the low end estimate is without medication, and medication is expensive, so that's something you have to factor in. But there are definitely workarounds and ways to pay for it. You can finance IVF, can work for an employer who does cover it, and that information actually is pretty publicly available.
Really?
I know that that's like a very time-consuming and strenuous thing to do, to try to find a job somewhere that will have that coverage. I just happen to luck out, but that is definitely a thing. Facebook, Google, those kinds of companies cover it. I think Starbucks does too. And there's also other options as well, like you can do an egg retrieval where you give half of your eggs as a donation, and that will cut down the cost. I know some clinics do that. Some clinics will also have a deal where you can preemptively sign up for 3 rounds. Like if you know you have diminished ovarian reserve, you're gonna have to do multiple rounds. If you pay up front for the 3 rounds, then it's a lot cheaper.
They'll cut you a 3 for 1 bargain.
Yeah, so there are definitely a lot of different ways to do it. I will say, I know that the transfer is usually between $2,000 to $5,000. So the transfer itself is much less expensive, but obviously the egg retrieval, there's anesthesia involved. The medications involved in that process are much more expensive too. So yeah, to answer your question, it is expensive. There are options. I kind of hate living in the US where it's not covered by most insurance plans, but luckily it was covered for us. The majority of it was. The next question is, did you wind up using donor sperm on all of your eggs? This is a question that arose because we have talked pretty openly on some of the vlogs, or at least I've talked openly, and Hayden has told me I can talk openly about it, that we decided to use donor sperm for half of our eggs. Because of Hayden's situation, we had no idea what the quality of sperm would be. That is something that you run into with fertility, unfortunately. There's statistics and a lot of stuff's tied to your age, etc. But when it comes to the actual genetic normalcy, I suppose you could say, of your eggs versus your sperm, there aren't really any good tests for those. Like they can't like biopsy an egg and tell you, oh, this is great, or a sperm and do the same. There are some tests that exist for DNA fragmentation on sperm, but the information that we get from that is like pretty mixed, and that wasn't an option for us anyway. So we just didn't want to retrieve eggs and have the potential of none of them fertilizing, none of them becoming embryos.
Yeah.
I mean, obviously, I want to have Hayden's child.
Yeah, but if they weren't going to work, period, then they weren't going to work, period, and so might as well hedge the bet, basically.
Yeah. We are very, I would say, level-headed, logical people, and I'm not saying that you're not logical if you decide that you don't want to use donor material, but for us, it was just, let's make the best of a potentially shitty situation. If we get great results, but like not enough embryos from Hayden, we could also do another round. Like there's so many options. This was kind of a diagnostic, and they often tell you, hey, your first round of egg retrieval is diagnostic. It doesn't work the first time for a lot of people.
And for me, I would have felt extra bad if not only did my stuff not work and not fertilize any eggs, but we used it on all of the eggs, and then we would have to do it again anyways, you know? I would feel bad about that.
Thankfully, we got embryos from both, and a lot from both. So we do know that Hayden's material works.
At least to the embryo stage. Like we haven't gotten
the genetic testing.
But
I think since we're here, it'll probably be okay. Yeah. Regardless, it's unlikely that we will end up using the donor material. So that is kind of not something that we think about, or we're not thinking about that right now. But we have considered that very deeply, I will say.
Yeah, for sure.
There's more questions about that. So did deciding to use donor material affect your relationship?
I would say no. I don't know how much this question is posed at me versus you, but the way that I think about it is either my stuff works or it doesn't, right? And if it works, then cool. If it doesn't work, then my options are to either adopt a child or have a child with donor material, but your egg, where at least it is your child. It would feel almost like spiteful to be like, oh, well, if it can't be my kid, then it can't be yours either. It didn't really make that much sense to me, and so no, for me it didn't affect how I felt about the relationship or the process or anything like that, because especially because it's due to something that I can't control. You know,
he
like
had cancer.
I had cancer when I was a baby, you know?
Nothing he can control for.
Yeah,
I will say we actually had slightly different perspectives at different points during the sort of like, are we going to use donor material? Are we going to, let's look at donor material together online? Because you get to look at like baby pictures and profiles, which is very it's like strange, I will say. It's a weird process. Honestly, for me, I was having the most, I don't know about this sort of feelings, but I think I tried to detach my emotions and just go for what made sense logically. And I felt like, you know, once we have the embryos, I think I will have more clarity around it. Didn't think I was going to regret it, and I definitely don't regret it now. Even though I know your stuff works, I don't regret doing that.
Yeah, because I mean, it just makes sense, you know?
Yeah, made sense for us. It might not make sense for you.
It might not make sense for you. Yeah, you might feel differently about it. You might feel like, oh, well, if it can't be both of our child, then let's just adopt. So, you know, we'll be like equal in the scenario or something like that. But
and everybody's going to come to a different conclusion. I also will mention too, I also thought of it from the perspective of like queer couples. If it's a lesbian couple, for instance, they're going to have to use donor material, whether it's a known donor or an anonymous donor. And they don't have, I would assume, the fraught sort of like, oh, it's not going to be biologically mine sort of thing. And frankly, like that's just not us anyway. Like we're just not that tied to the idea of biology. Like, yes, I would love to carry my own child, but it's not the biology that excites me. I want to be pregnant, which we'll get to later. All that to say, it didn't really affect our relationship. The next question is, are you doing PGS PGS or PGTA testing? And are you genetic testing for gender or just at random? Okay, so PGS and PGTA testing are considered the same thing. PGTA, I believe, is like the newer term, and it is basically the base level of genetic testing that you can do on embryos. Okay. There's a few different kinds that you can do, but PGTA testing looks at the cells on the outside of the embryo and tests the chromosomes specifically. It doesn't get into gene-specific things. There is testing for that. It's a little more invasive and potentially riskier, but PGTA testing is very standard, and it's something that a lot of people tend to opt into because it can very much reduce the risk of miscarriage. So PGTA testing was something that was covered by our insurance as kind of a part of the package deal, basically. There are a couple of things that were covered, which was just general freeze-all cycle IVF with ICSI included, which is when you put the sperm directly into the egg rather than just like putting them in a dish and saying what fertilizes. Then also PGTA testing was covered. Basically just test the chromosomes on the outside, and those chromosomes or like the cells on the outside tend to turn into the placenta, so it's not damaging the embryo itself when they're testing these things. And we did not decide to do this for gender or for sex, but that is one of the things that you do typically find out. Depending on your state, some states actually don't allow you to see the sex of your child.
Really? I didn't know that.
Yeah, but Texas does allow you to find out the sex, and honestly, I like to look at it as a little treat, you know? Like I had to go through this shit, and I can choose, I guess. Basically, embryos develop between 5 to 7 days, and the 5 and 6 day embryos tend to be better quality than day 7 embryos, so they kind of grade based on days, and then also grade based on is the embryo euploid, which is chromosomally normal, or aneuploid, which is chromosomally abnormal. They also tell you the sex. So for us, obviously, if the top 3 embryos that we have are all not our preferred sex, obviously I want a healthy baby. Like that is my priority, is like having a healthy baby, carrying my baby to term.
Yeah, like if we only have one like S tier embryo,
yeah, like we're gonna transfer
we have
that
to use
one.
that one, you know.
But if it's, you know, all odds are the same or everything else equal, I would choose the sex of my child. And the next question was, will you opt to know the sex or do you want it to be a mystery? I personally want to know. I think it will help me feel more connected to this process. And again, it's just kind of a perk. I know some people want that to feel more like a traditional pregnancy where you find out at like, I don't know, what is it, 12 to 20 weeks or something like that. But honestly, I don't care about that. There are other things that I'm going to do to make my pregnancy feel more normal. For us, that we made the decision that we will know the sex, and if we have the choice, we will choose the sex of our child. The next question is, how is Haden feeling about the results of the egg retrieval?
Good. I mean, I didn't know if my stuff worked at all. Okay, so we had kind of a little like roller coaster. So initially, you know, obviously we didn't know how my stuff worked at all. After the egg transfer, or sorry, after the egg retrieval, they immediately fertilized the eggs.
Yes.
So when we got the results back from the fertilization, I was feeling really good because obviously, and I found out that I fertilized a decent number of eggs, you know, like more eggs than the donor actually.
Yes.
And so I was feeling really good about that because I was like, at least it works well enough to fertilize. Yeah. And then they give you results for your embryo's progress.
Yeah, so kind of the way it works in terms of like the actual embryo development is that once they hit a certain look, I guess, is when they freeze them, right? And that could happen on day 5, 6, or 7. So you get like a day 5 report of like, on day 5, this is how many we could freeze.
Yeah, and so on day 5, when we got the results, I think I only had 1 embryo on day 5. Yeah. And I think the donor had, I can't remember how many the donor had, but it was definitely like more. Like it was kind of a more normal number to expect.
For day 5, yeah.
Yeah, for day 5.
We were bummed.
Yeah, but I wasn't like crushed because I knew that we still had day 6 and day 7 left as possibilities, but definitely took a bit of a dip there.
Yeah.
But that's the only time that I've really been feeling negative about it. And then day 6, we got the results back and I again had more embryos than the donor. So yeah, I'm feeling good about it overall. I'm also just very happy that we got good results on our first egg retrieval, because one of the things that I personally have struggled with, and I know it sounds kind of like stupid or selfish, but I hate that Chandler's had to go through this, you know? And obviously I feel a little bit of guilt about it, even though it's not something that I did necessarily. It is because of me that she's got to like stick herself with needles and have her blood drawn and stuff like that, and have your ovaries swell up to the size of a grapefruit. And so
yeah, that's true.
Obviously I don't feel great about that. And so the least number of times that I can quote unquote put you through that, even though I didn't ask you, you know, I didn't like force you to go through this. Like I know that it is your choice too. Yeah, I do feel a little bit bad about it. And so I am really happy that 1, my stuff works, and 2, we only had to do the egg retrieval hopefully 1 time, but it's looking like 1 time.
Oh, an interesting thing that I will point out that I don't know if we've mentioned elsewhere is the day 7 report was the most interesting though, because they told us that 2 more embryos had been frozen for biopsy. They did not tell us whose embryos those were.
Yeah,
it doesn't really matter, but like we were just, I want to know what the final numbers were.
Yeah.
And I'm sure we'll find out like once we get the actual report back, but like I just thought that was interesting. everything. So the next question is, what's the best way to support your partner through this process? We're getting into the emotional category.
I mean, I think that that's really difficult to answer because I think it really depends on your situation. You know, like everyone has a very specific infertility journey.
Yeah. I think the best thing you can do is to stay in communication about your needs. And I don't mean that you need to communicate all the time about everything you're feeling, because sometimes those feelings are not best shared with your partner. And I'll get into that in like another question that I'm going to answer. But I think like communicating what you need is super, super important. Like, hey, honestly, I just need some time to like think about this, or like I really need to like vent or whatever. Communicating that I think is important because you don't want to leave your partner in the dark, especially if your partner is the one who is the main factor. You don't want that person to be like sitting there sad and you not support them. You know, it's just complicated. I think emotionally we were in sort of a weird spot because when you are dealing with male factor, unfortunately, it just is the case that it is your factor, but I'm the one that has to undergo
I can't do basically anything about it.
So it does have complicating, the emotions are big. Like you definitely are going to have big emotions. And I think communicating your needs is important. Not always your emotions, but your needs is important.
Yeah.
The next question is, did you find the process to be emotionally isolating? And did you feel like you could talk about it with friends and family? I'll answer first. So I think this question is definitely going to vary person to person. For me, I don't really allow those sorts of thoughts to go into my fucking head. I'm gonna be honest. For me, if you are my friend and I talk to you daily, you're gonna get my stream of consciousness thoughts and I'm gonna tell you how I'm feeling. I did not hesitate. I had my two best friends, my sister and my mom, and I was constantly telling them, I just got the results back from my embryo report. I'm stressed. You know, I'm feeling really sad, or like I feel like I can't talk to Hayden about this, not because he wouldn't be there to support me, but because it was about him and I didn't want to like make him sad. So I actually didn't feel isolated. I think at times like you do feel sad seeing people around you get pregnant and have no idea how hard it can be to conceive, but I didn't think about that a ton, and I think that was because I had friends and family who were willing to listen. And I think you, unfortunately, in almost all situations, if you need something, you kind of have to communicate it. Whether you have a loss in your family that you're sad about. Unfortunately, when it comes to hard topics, people are just not really great at asking questions or being there unless you bring it to them. And so I always brought it to them rather than having them come to me and ask like, oh, are you okay? It's not fun for someone to ask that all the time. Not that it should be a responsibility always to bring your infertility up, but yeah, I really took it upon myself to like seek what I needed, and I think that really, really helped me. Easier said than done, but I do think having a support system, especially outside of your partner, is pretty important.
For me, I have a tendency to not share my emotions as much as I should, just generally. But the thing for me was I did obviously have some feelings about the fact that I wasn't that fertile. Those feelings were hugely outweighed by the feeling of, I guess, like guilt or sadness that I had to then put you through something in order for us to have a child. I definitely communicated that to you, I would say more than I did other people, but it wasn't because I don't have people that would listen to that. Didn't feel that productive to share with other people that I was feeling bad for you.
But that being said, you might not have shared your emotions, but you talk to your mom very often about infertility.
For sure.
All of your friends knew we were doing IVF.
Yeah,
so
yeah. I didn't like
secret.
keep it from them. I just meant specifically this question was about emotionally.
Yeah.
How much were you sharing your feelings with the people around you, or did you feel like you could? And I definitely felt like I could. I have great friends and family all around me. I would say a lot of the times I have a tendency to not share as much as I could.
That being said, how are you feeling emotionally?
Well, I'm feeling good now. Ish. I mean, I've already said it before many times. The main feeling that I have is guilt. And I think I'm going to continue feeling that until you're no longer having to put needles in you.
You don't think you're going to feel that way when I'm pregnant?
Well, yeah, because you're still going to be putting needles in you. But then after that, you wanted this. So, you know, I can't feel that bad for you while you're pregnant. I don't want to have a baby inside me. But if you do, then...
That's on you.
Yeah.
So I emotionally am feeling really good. We've set a transfer date. I will not be telling you when that is because I don't know if it'll be successful, and also that's my business and not yours. But I'm feeling really good. I think once we set the transfer date, I felt this feeling of, oh shit, like I could be pregnant soon. Like it's getting real. So I emotionally am like excited, nervous. I'm just so grateful. I can't express to you how lucky I feel, especially given all of the stuff I've read on Reddit, all of these people who are suffering because their outcomes are not the same as mine. I feel blessed every day. I feel so incredibly grateful and fortunate. So I'm feeling really good. Like emotionally, I'm feeling awesome. Not looking forward to getting shots in my ass. But other than that, I'm feeling great. What's the best and worst part of this journey?
Best part?
Hopefully we'll have a kid at the end of it.
Yeah, I think the answer is like having a kid at the end of this, but technically if things worked like they should, then this wouldn't be a journey in the first place and there would still be the same outcome. So I don't know if I would say that that's a best outcome, but it is the outcome,
so,
you know?
I'm going to take a different tact, but
okay,
yes.
Go for it.
So I would say best part is I think it has given us a lot of time to consider what it means to be a parent, what we want from our lifestyle once we have a child. And I'm not saying that people don't do this if they get pregnant spontaneously, but I think for us, we have really had to think about like what we want out of life and how our kid's gonna fit into that. And I think it has brought us closer together for sure.
Oh yeah.
We've had, really tough times. The worst part obviously is having to do it in the first place. No one is excited to inject themselves with needles or undergo surgeries just to have a kid. Some people just get to fuck and have a kid, and we just don't. That sucks.
Yeah. Logistically, in
blood
actuality,
draws.
the worst part is blood draws, and part of that being the frequency, and the other part of that being the fact that it's early as hell in the morning.
Yeah.
When you
it's
have
always
to do
early
it.
in the morning.
It sucks.
So that's the worst part. But yeah, I feel really lucky in that we had one of the easiest times that you could possibly have. Basically went textbook perfect, and I really can't complain. I told Haden too, after I did the egg retrieval, even like the day of and the day after when you're supposed to be in the most pain, I was like, I could do this again. I don't want to. Yeah. I really don't want to.
But like if you had to, the other like positives that I would think about is like, not only did we really have to consider having a child, we get to choose when we're ready. And if we want to, we can choose the gender.
And if you are someone who is medically nervous, there's something really cool knowing that your embryos are chromosomally normal and your instance of miscarriage is much lower. And I think that's really cool. The next question is, what advice would you give someone starting out, and what do you wish you knew ahead of time? I took notes on this because I wanted to give it some thought. The first one that I put is, it's always going to take longer than you think, even if your body is cooperative, and that's a big fucking if. Your body is going to do weird things, and if you're going to pursue infertility treatment, it's likely that your body is the one that's going to do weird things. I have PCOS. Really the only complicating factor there is that my cycles are longer, and that basically put us back a couple of weeks for our egg retrieval, and that fucking sucks. So it took longer than I wanted it to. We had to move a vacation around. It's just always going to take longer. So I think going in with a little expectation in terms of, oh, I'm going to be pregnant by this month, just get that out of your head. That's not a possibility. Just take everything day by day. The next one I have is to not stop planning fun things for yourself. I think it's really easy to get caught up in this process, but it's a couple of months at the very short end. We've been doing this stuff since July, and we are moving at a rapid clip. I just think it's important to prioritize your life and not forget that you have one. I think for me, it's been hard to focus on like everyday tasks and stuff, but like plan fun stuff when you can. I was on birth control for 3 weeks before we started the egg retrieval to get all of my follicles to like cooperate at a baseline. We went to Disney. We'd already planned on going on that trip, but specifically I was like, you know what? Let's do this while we can and like have some fun. Yeah. And instead of sitting around for a week being sad and or just excited for the stims to start happening, I got to have fun with my husband and like connect with him. And I just think plan things to get out of your house. I'm not saying you need to go on an expensive vacation, but please get out of your house. Also that you're going to need a support system outside of just your partner. I think again, we are in a unique situation where I won't lie, and he knows this because I did communicate this to him. I was pretty resentful at the beginning because I have medical fear. I was scared. I didn't want to put my body through this. By all accounts, I probably could get spontaneously pregnant. So it's like hard not to be a little bit upset that he doesn't have to do anything. You just feel these feelings, but like that's not always the most productive thing to aim at your partner who's already dealing with the emotions associated with that. So I think having a therapist, a trusted friend, family member that you can express these feelings to sometimes is important. And that's why I said earlier on, communicating is important with your partner, but it's more so about communicating your needs rather than your actual emotions.
I guess to add on to that point, if you don't have friends or family or someone immediately that you can talk to, there are definitely support groups and other communities online that you can find to like talk to or vent to or communicate with.
IVF Reddit is phenomenal.
We are fortunate enough to live in a day and age where the internet makes it easy to find those people. Like it doesn't have to be someone who lives next door to you that you can speak to face to face. So
yeah. I will say part of the reason that we are making this video in general is I will say sometimes it can feel like you're the only person going through a particular thing. I think I have not seen very many videos where it's male factor discussed. I've not seen a lot of videos with a heterosexual couple where there is donor material involved. Like I've seen same-sex couples like use donor material. I just wanted to like normalize it, and also I want people to know that the things that you're experiencing and feeling are normal. This sucks, but like it is normal. I just didn't see a lot of this when it came to quality things, right? I remember Googling trying to figure out what's my likelihood of success if like my partner's had cancer. I couldn't find anything. I found a couple of people whose partner had testicular cancer, but if sharing this can help someone going through something similar, that is so important to me. So find a support system, seek out information on YouTube, Reddit, whatever, because it can really help you feel seen if you don't have someone who's like directly going through it. And then the last two things I'll say, number one, always ask questions and advocate for yourself. Haden touched on it earlier, but a big part of this that you don't think about is that this is kind of one of the only medical things that you might experience in your lifetime where you are doing this voluntarily and you are in charge of that process. I didn't realize how much I would have to call up my clinic and be like, hey, what are the next steps for this? You know, they don't always reach out to you. They're relying on you to reach out to them. And that's for so many reasons, right? It's expensive. They don't want to push you, whatever. But like you are going to have to advocate for yourself. And I know for me, having insurance coverage, so grateful for it. But I was on the phone multiple times a week with my insurance because they kept screwing up my claims and all kinds of things. So you really have to be on top of it and just prepare yourself for having to advocate for yourself. Unfortunately, it's not one size fits all. And you know your body better than anybody else. So feel free to speak up and ask questions questions if you have questions too.
To that extent, also educated about it, like educate yourself big time so that you can properly advocate for yourself.
And ask questions, And then the last thing I would say, maybe contradictory, is like go in with zero expectations, but also remain hopeful. I think the thing that I struggled with was that I was seeing so many accounts online of negative stories about IVF, because most people who are seeking support on places like Reddit are going to tell you their horror stories, right? And that makes sense. And I'm glad that those exist for people who need that support. And I'm glad that I went in, I think, with low expectations. But I also think that that left me in a place where I wasn't able to be as hopeful as I could, especially because my doctor never gave any indication that we would have trouble, and she can't predict things. But it wasn't like people were telling me to temper my expectations and I was too hopeful. It was like people were telling me this is probably going to be successful, and I was like, I don't fucking think so. And I wish that I would have just allowed myself to enjoy parts of it. I know that probably sounds weird, but at the end of the day, this is hopefully getting us one step closer to having a kid together. So I wish that I could have been more hopeful throughout the process, but now that I am kind of at the tail end of it, I feel like I can offer that advice at least. Kind of related, I guess, to the next question, which is if I'm going to do IVF in the future, I'm pretty sure that I'm gonna have to do it. Is there anything that I can do to prepare? And I really think you've got it covered at this point. If you know you're going to have to do IVF, you have an incredible leg up, and I think that's where a lot of people tend to struggle. And I think maybe, again, that contributes to why I felt the way I did emotionally. But I knew before I got tested, not to be rude, but like what the issue was.
Yeah, for
you know, I already knew before we had our initial consultation, we will be doing IVF. We don't have an option for IUI. It's male factor. This is what we're doing. Even if I had complicating factors, this is what we're doing. And I think just knowing that helps you prepare emotionally. You can get all your crying and sadness out before you even have that consultation, so that you can go into IVF being like, you know what, I'm doing this, let's get this done. And I think I mostly had that attitude. Yeah, there's some sadness. Yeah, sometimes I'll cry, and I'm not saying that I didn't allow myself to feel those negative emotions, but I didn't have as many of those as I thought that I would. So I think if you know you're going to do it, you already have a leg up. But I don't think there's anything you can really do to prepare yourself except for watching videos about it and kind of understanding each part of the process. I think that helps you, again, so you can advocate for yourself, but there's nothing that you need to do really in advance to prepare yourself.
Besides educate yourself, the more you can learn about all of the different possibilities and the different drug treatments and all of that sort of thing to help you better advocate for yourself.
Just one instance of this, there is a trigger that you inject yourself with to trigger ovulation. There's a couple of different kinds, and I knew that there was one kind that would potentially cause me to have OHSS. I was scared of that. I knew that that was a thing. And so if my doctor hadn't changed my trigger, I would have asked her to. I would have talked to her about it. I would have asked questions. Thankfully, she already had it covered. But had I not known anything about the drugs, I wouldn't have known to advocate for myself. And I think that's how you can sometimes get yourself in trouble. Let's speed through these last 3 questions, shall we? Something you wish was universally known or common knowledge about IVF that isn't. For me, the biggest thing really is what we covered earlier. This misconception, are you gonna have 8 babies at once? That's just not a thing with IVF, and it's becoming less of a thing now. I honestly think there's not a lot that I think isn't common knowledge, but what I would really love, truly, if you know someone that's going through IVF or you've just been curious about it, even if you don't want kids, I would really urge you to do some cursory research on what it is. Like if this hasn't covered it for you, do some cursory research, because being a listening ear to someone going through this, I think is really important. And I think the reason that so many people don't know how to be supportive when it comes to grief, when it comes to just any hard topic that comes up, is because you've never been through it yourself. And you can never put yourself in someone else's shoes if that's never happened to you. But by doing research, I think it takes the fear out of it and it makes you feel less dumb almost. I don't know. I just feel like in the past, people have come to me with hard things and I'm like, it's not that I don't want to listen, but like, I don't know what the hell is going on. And just, I think the love and care and affection you can give to someone by doing your own research, I think is really helpful. That being said, don't provide your advice. No one wants your advice. No one wants your IVF advice if you're not going through it. There were times where, sadly, no one I know is going through IVF. I had to educate my mom and my sister on what different things mean. I was telling my mom day 5 embryo numbers and she was like, I'll be honest, like I don't really know what that means. Having to explain that. It's not the end of the world, but it's just really nice when someone you care about has done the research in advance. So I would say if you can do that, I think that you have a leg up. I generally like doing that too. I think it makes you a more empathetic person.
Yeah. So I guess like a broader way to answer something that you wish was universally known or common knowledge about IVF that isn't, it would be basically everything about IVF. Because I would say for the most part, IVF, what it is and what it involves isn't common knowledge.
You don't need to know the different drug regimens. But just
for sure.
Generally the process and what it entails, I think gives you an incredible amount of empathy and can make you a really supportive and awesome friend or partner.
For me, IVF taught me so much about the female body that I either didn't know or that I thought I knew but misunderstood.
When he says female body, he means people who have
ovaries and uteruses and menstrual cycles and ovulation and follicles and all of that stuff. I just had no idea really how all of that stuff. I knew a lot of it, but there were just very specific things that are involved in the IVF process that I just didn't know
like
about.
How your hormones interplay with the different things, how follicle stimulating hormone works, luteinizing hormone, ovulation. There's so many different things. It's fascinating and it's cool to learn more about your own body, even if you're not going going through IVF. Last two questions. Why IVF and not adoption? And I want to answer this question because it is a horrible question to ask anyone going through infertility treatment, and adoption is not the answer to infertility. Anyone in the adoption community, I would bet, would tell you the same thing. We definitely discuss fostering and adopting throughout our entire relationship as a potential means to start a family. But the more that you learn about that, you realize what adoption entails and exactly what it means for the adopted person. And the rise of TikTok, there has been so much talk about what it means to be donor conceived, what it means to be adopted, and just the associated trauma. And I don't think that all adoption is bad. There are plenty of people who've been adopted who see it as a positive experience. But when it comes to adoption, a lot of adoption is done as infant adoption, which can cause trauma on the part of the mother and the child. There's also fostering, and fostering, the goal of that is reunification. It is not to place a child in your care forever. It's complicated, and I think that more people, again, should do research on what adoption is and what it is not. It can be a really incredible thing, but it is not a cure for infertility. And I think that when people pose it as an alternative to IVF, it just does a disservice to everyone, and I think that it shows a real, for lack of a better word, ignorance. So I would really hope that people would do more research on adoption and what that means and what IVF is and what that means. Again, I'm not trying to dog on anyone who's made different decisions than us, but I do think that to call them interchangeable is just a complete disservice to adoption. And, you know, I've considered foster in the past too. Now that I know more about it, I think foster is really awesome. Like, to be a safe space for a child, even if they won't be your forever child. I think that's a really cool thing. I could see us fostering in the future, but we understand what that means, and it's not a solution for infertility. And then the last question is, are you excited to be pregnant? What about you, Hayden? Are you excited?
I can't answer that. I'm not going to be pregnant. No, I'm not excited for you to be pregnant. I'm excited to have a kid, but I know that you were just going to be a handful when you're pregnant.
I was a handful.
Because you're already a handful.
I am already a handful.
Regularly, you're a handful.
I'm going to be 2 handfuls.
Obviously, you were a handful when you were going through the egg retrieval stuff, but yeah. I could be wrong, but I think that was worse than what pregnancy is going to be like. You know, you were...
That's a big if.
No, you were completely immobile for a large portion of it.
To be honest, that was the worst part, is like not being able to do my everyday activities because my ovaries were so big. But
yeah, at least with pregnancy, and again, I could be wrong. I've never been pregnant. You've never been pregnant. The change will be slowly over 9 months instead of over the course of 5 days. You will swell up.
Dude, it was like a Bella Swan pregnancy. Now that I'm thinking about it, that is literally the best way to describe the egg retrieval process. But I am very excited to be pregnant. I have not always felt that way. I've always wanted kids. I didn't always think that I wanted to be pregnant. Again, I incorrectly assumed that adoption was the way to have a kid. So I thought maybe I'd do that, or that I'd get a surrogate, or like all these different things. But with age and experience, and with understanding that I'm really strong and I am capable of handling pain, I think pregnancy is really fucking cool, and I'm really excited to be pregnant. So
yeah, it's gonna be kind of wild.
I just think it's really neat. Never thought that I'd feel that way, but I like am genuinely excited to be pregnant. I think it's gonna be really neat. I'm actually not scared of birth either. I know some people are down to be pregnant and scared of birth, and I'm, you know what, bring it on. Hope I don't die, but like, it seems pretty tight. It's usually like a 1, maybe 2 day experience.
Yeah.
Some healing.
Like, obviously you're not even pregnant yet, but just the whole thing makes me just think about how crazy the human body is in general, you know? Yeah.
Much appreciation for my body. That is one of the unintended consequences of this, is that I am so much stronger than I thought that I was. I can handle pain like a pro. I can do pregnancy. I think I can do it. Just watch me like complain the entire 9 months. I mean, I'm sure I will.
Oh yeah, definitely you will. I know.
But I think I can do it. I'm looking forward to it. So hopefully that happens sooner rather than later. Like I said, we have transfer date set, which is scary.
It's gonna be like 3 weeks after you find out that you are pregnant that you're gonna be like, oh, I can't take this anymore. It hasn't even started growing inside you yet. I can't do it.
I mean, to be fair, that's when morning sickness kicks in big time for people. So
yeah.
I might not be able to do that. I do not handle nausea well. Yeah, it'll be an adventure for sure, and I'll keep y'all posted on that. I will say that I will be doing a video on the embryo transfer process, but I would personally like to have a successful transfer before I share that information. And also, there's not much that I get to have that is uniquely mine. And frankly, I have always wanted to completely keep my pregnancy a secret from the internet. I won't really be able to do that, nor do I want to at this point anyway. I do want to keep my early pregnancy to myself. Get through that first trimester or the first like 20 weeks and just like have it be between me and my family. I think that would be really special. I will make another one of these videos when the transfer is successful, fingers crossed, but I don't want to get ahead of myself.
It'll be in the vault for a while, so keep your little paws off.
Yeah. I am looking forward to these next steps, and I'm excited to share it with y'all. I hope that this successfully answered all of your questions. If you have any additional questions, leave them in the comments down below, and I'll try to answer them as best as I can in that comment section. Again, sorry if we misspoke at any point during this. I know that with talk of this, it's, you know, there's a lot of gendered language, which we are not always combating, but we acknowledge that not everyone who carries a child is a woman. We also acknowledge that gender and sex are not the same thing. So if we use this interchangeably, my apologies. But yeah, I hope this was semi-informative, and love y'all so much. Thanks so much for watching, and thank you so much for your support over these past few months. Your advice and your support has been invaluable. So see you in the next one.